Okay, and now we're going to work on the parasternal short axis of the ventricle level. Depending on where you've ended, if you probably have ended at the great vessel level, there's two things you can try here. So just get back for short axis really quick. Now I think you're too rolled up, Abby. There, right about there. So we can get back to her short axis, and instead of tilting up or superior towards the shoulder, we're gonna tilt down to the left hip. Very slowly. This is an in-between view, okay? This means you're not tilted far enough. You only see one leaflet, which is the anterior leaflet. So really what you wanna do is tilt just a little bit more, and now we can see the posterior leaflet. To clear this image, climb towards her sternum or move medial towards the sternum. Again, with this image, what you're looking for is a perfectly circular image. You don't want it to be oval. You want it to be nice and circular. Again, finger width of depth below, adjusting the focus to the area of interest. Take this down one. I'm going to adjust my TGCs in the far field here. And I'll clip it. Next picture is we really want to look at the morphology of our anterior and posterior mitral valve leaflet. We want to see what's happening. So I'm going to adjust the box around just the left ventricle here. And I'm going to click zoom. Both 2D and then a color image. And I'm going to adjust my box again so it's a little over the ventricular septum in case I've missed a muscular VSD or there's inlet VSD present. I'm also going to look for regurgitation. Now if she had mitral regurgitation, it would be between the anterior and posterior leaflet. If you see aliasing of color flow up here above the anterior leaflet within the ventricular cavity, that is actually aortic regurgitation. Kind of remember from what I told you last time. All right, so we're going to click on 2D because 2D gets us home. Now I'm going to tilt further towards her hip. Notice how my right ventricle is still in the view. That's just as important as the left. Moving towards her sternum to make things more circular. I move up a rib space. That's even a little better. And again, the reason why we want to look at this view here is because we can see all three coronary arteries and how they feed those segments. Six segments, yep. Got a moment. Now this will be one of the times that you are going to be performing in M mode. So you're going to get your cursor ready. It's done at the papillary level or mid-ventricular level. Notice how my cursor is nice and straight up and down. And a circular LV and a little bit of RV on top. I'm going to press the M mode button. I think our machine is overheating again.
So the cursor doesn't have to be through the mitral valve?
Not through the mitral valve. For other stuff it can be.
Okay.
But for your competencies and your test out, we want an M mode at the mid-papillary level.
Okay.
So on here again, the information, it's one-dimensional information. So we follow the cursor line on the 2D image to know what we're looking at on the M mode image. Okay. So you can see that it's transecting the RV free wall, which is up here, the RV cavity, the interventricular septum, the LV cavity, and also the posterior wall, and this bright white is the pericardium. We talked about measuring just a little bit. We'll get some more practice in measuring when we go to ProSolve. But we would clip this as well. As you can see, the M mode is showing us the motion versus the time. So this is diastole or end diastole, and then when it comes together, it's end systole. So it's nice and relaxed and open diastole. When it comes together, systole.
And just to, reiterate what Mel said, we'll just get this for an MO, but Abby, back to your question, if we had things like hypertrophic cardiomyopathy, or what's called SAM, systolic anterior motion of the mitral valve, then we would get an MO through the mitral valve. Pulmonary hypertension, we would get it through the pulmonary valve. So there's other uses for MO on valves too,
Okay.
that we'll
Big
talk
class
about later.
coming.
Yep,
Okay.
that's later.
This is the only required one. The other ones that you can perform based on your, as you're interrogating your pathology.
Gotcha.
Okay, so again, for the last picture, we're gonna be looking at the apex. So I like to call this an L maneuver. Okay, so on this one, I'm gonna just drop a rib space, and now I'm gonna move more lateral on the chest while my beam is still tilted towards the hip. Now this didn't fully cover it or do the trick. So it's not just one rib space, sometimes it's more than one rib space. So I'm gonna go down 2 rib spaces here. It's a little bit better. And now I'm gonna just pull a little bit lateral and tilt way towards the hip. Breathing techniques can be used throughout. I'm dropping my depth, I'm getting ready. And Abby, can you take a small breath in and hold it? So what the lungs did here was they pushed the heart into a little bit of a clearer view. And breathe. That's about as far as I can get, Chris. So that's the maneuver that we're gonna do. And that would be the end of this particular competency.